This conference will now be recorded.
Good morning. I'm Jeffrey Popkin. I'm a independent consultant working with the Bakersfield ARC. They have a grant from the State of California Department of Developmental Services and the Kern Regional Center, specific to issues related to the home and community-based waiver. Um, the idea behind this is to provide training so that people can be in compliance with the rules related to the changes that came about in 2014 at the federal level. They're originally supposed to go into effect in 2019. They were delayed twice, once because just the difficulty in which it occurred to get into compliance. And then second, with the COVID pandemic, they once again delayed the implementation. The official date for everyone to be in compliance was March 18th of 2023. Um, California asked for a one-year extension on assessing facilities, which the federal government granted. But now they are in the process of starting to do assessments on all facilities, which means going out to the facility and do a hands-on, eye-to-eye, looking at the folders, talking with the administrator, talking with any staff you have, any direct service professionals, and also talking with persons that are served in your home. And one thing I would like to mention, somebody brought this to my attention recently. Throughout these presentations, at times I will sometimes use the term client to refer to the people that we serve. Uh, our local community, our um, client advisory committee, said they would prefer that term to consumer or person served. Um, However, in most situations, the people first language is now that you refer to people as individuals served, just individuals, and getting away from some of the older terms. But sometimes I still slip back and use the term client because that's what I was raised on. And also, that's what our local community has said is their preference. So just FYI for any of you who may have challenges regards to the terminology being used. Um, okay, so today's presentation is a change from what was originally on the agenda. Uh, we had put down health and safety is what we were going to be addressing today, but based on the request from Kern Regional Center from Leslie over there, they've started now to do the assessments on facilities. And so she thought it would be a good idea to go over again some of what they're looking for when they go out and do the evaluation of your home, of your day program. Today, we're focusing primarily on the needs of day programs. So we're going to discuss the six areas that affect a day program. Next week, we'll discuss the 10 that refer to residential. So if you're a residential provider, today's one was is more geared towards day services, but you're welcome to be on this one. If you take both this and the next one, you only get credit for one because much of the material is the same. And we just are attempting to have two communities of practice, one for each area, so we can get a little bit more specific to the different areas. Uh, okay, oops. Um, if you want continuing education credit for today, many of you have seen this slide before. We put it up every time. You must attend the entire webinar Community of Practice to obtain CEU credit. you must identify yourself at the beginning of the presentation on the screen or in the chat. So if your name is on the screen, then you're fine. If not, please put it in the chat. If more than one person is on the screen or the telephone call, each person wanting credit must be identified. So we need, so if there's two of you in the room and one person signed in, the other person needs to let us know. An email must be sent to Irene at Bakersfield ARC, which identifies in writing three concepts that you learned from this presentation. So what are three things that you learned today? And that way we know you attended the whole presentation. And credit requests must be submitted within 30 days of the presentation, so we can keep track of who's taking the classes and get the credit out timely. Um, what I'd like to do is share with you very briefly trainings that are coming up through CQL. They are a national organization, the Council on Quality and Leadership. Uh, they will be doing a series of uh, webinars for this project. They are a national organization. They are considered to be one of the top organizations in the country on these issues. If you were to go to their website and sign up for these classes, they're $100 a class. Through this grant, you can take these courses for free, and they are offered in many cases either once or twice between now and the end of June. First one that's coming up is tomorrow. Is person-centered thinking. Person-centered thinking is basically the bedrock of home and community-based waiver. It's all about the person, what they would like, what their hopes and dreams are. And if you're interested in taking that class, uh, if you go back to my the newsletter that I sent out about a week and a half ago, all these addresses are on there, but they're also on the screen. Now it's going to be offered tomorrow from 9 to 1, and then again on June 25th from 9 to 1. All of the classes are 4-hour classes. So if you're interested, I would encourage you to take it. Top level people from throughout the country are involved with these presentations, and they're very forward thinking in terms of the material that they would present to you. Um, the other trainings that are available on February 22nd, Everyone Has Rights, and that will be offered again on May 14th. And this talks about client rights and the importance of doing that. And interesting enough, they've got some studies that show that if you allow, or if you not allow, but if you adhere to client rights, and so that clients have a right to do what they would like to do, then your home will run better, your day program will run better. There'll be less behavioral challenges. There'll be clients will be more involved in the activities and the things that go on within your program. The next training, exploring communication. Not everyone communicates verbally, or some people use a combination of communication skills. So if you have clients who have limited verbal capacity, use sign, use communication equipment, etc. This is a good class to take for looking at ways of communicating with people who don't or only limited use of traditional communication methods. The three E's, that has to do with the foundation of informed choice. Informed choice is where clients are, in making their decision, they have an understanding of why they're making those decisions. Uh, Education, exposure, and I can't think of the third one. Valerie, remember? Opportunity, no, that's well. Anyway, so there are three foundations to that, and that will be discussed on April 18th. Um, then
You're
person-centered.
talking about education, experience, and exposure?
Yeah, that was it. Okay, I forgot experience. Thank you. Um, Personal centered thinking, again, will be offered April 30th. Community building and connection will be offered May 30th. And embracing dignity of risk, which is where clients have an opportunity to try new things in their lives and encouraging that, will be offered on June 13th. So that's in a nutshell. Top level classes that will be offered to you. There was one other class that was the PALM training, which is a week long training. That's full, but we hope to be offering that again in the fall. So stay tuned on that if you're interested in taking a week training course. That is just excellent. And that one runs around $800 if you were to take it on your own. And again, it'll be free through this program. Okay. The greatest problem with communication is the illusion that it has occurred. A lot of times we think we're communicating. We think we're sharing our ideas, our thoughts, our conclusions, how we're running our program, but the other person may not be hearing it, or they what they hear is different. Um, about 50% of what I share with you today, you will remember. And some of what you will remember also will not be exactly what I said. It'll be something different. So when we are communicating with others, we want to make sure it's a good idea to check it out with that other person to find out, did they really understand what you're saying. And the importance of that comes to play when you start looking at the evaluation that you did of your own facility back in 2022 or in 2023 to obtain paper compliance. And if you have this document, which you submitted to Kern Regional Center, and that's how you became compliant on paper anyway with the rules, go back and pull it up, look at it, see if it's still relevant, see what you put down, talk with if you have DSPs that work for you, sit down with them, show them the document, talk about what's in the document and why that's important to how your facility is run and what's in there. If you find things that are in there that since you started taking the training, you could do a better job on. So now that you realize, wait a minute, we wrote this last uh, year in January, and now we know that there's a better way to do it, even than the way we were doing it back then. Uh, you can modify it. But you don't have to necessarily modify it in this document, but modify it in your program design, modify it in which then you should submit to the regional center, modify it in the paperwork. If you have a client handbook, if you have other things, you want to make sure that it's up to date so that when the team comes out and then start asking you questions specific to your facility and how you're in compliance, you'll be able to talk about each of the areas that compliance addresses. Okay, the first one has to do with access to the community. The setting, meaning your facility, your home, whatever, is integrated in and fully access to individuals receiving Medicaid, HCBS to the greatest community, to the greater community, including opportunities to seek employment and work in competitive integrated settings, engage in community life, control personal resources, and receive services in the community to the same degree of access as individuals not receiving Medicaid HCBS services. Now, I was asked a while ago about specifically, um, well, we're a day program, and the clients come here because they want to have day services. They don't necessarily want to go into employment. So what should we do? Because it says here opportunity to seek employment and work in competitive integrated settings. You want to document at the time of your annual meeting and subsequent meetings that you have with the client and with regional center and that client's circle of support, that the client was offered an opportunity. In other words, as a provider, you said, okay, we don't necessarily provide vocational services, or we have a division that does, but it's not where you're currently involved with. It's another part of our program. And if you want, we can make a referral back to the regional center to see about getting you into employment services if that's what you so choose. And if the individual served says, no, I would prefer to be in uh, a day activity program, then you want to document that so that the client had an opportunity to do that and chose to do other. Now, this is a community of practice, and one of the things that's happened over the last 6 months since I've started these community of practices is I've been doing most of the talking because uh, when I've asked folks to respond, I oftentimes don't get much response back. But I'd like to try that today and see what where we go with that. So what does access to community mean to any of you? You go ahead and open your mic and just speak up. Go ahead.
Means being able to go out, to spend time, go to the movies, go to the grocery stores, to be able to do those kind of things.
Movie, grocery store, use the community, right?
Yes. It's such a
Uh-huh.
big term, community.
Yes.
Yeah. Well, when you go out, do you say to your staff people and other folks, I'm going to go out into the community now? Or do you say, I'm going to, I've got to do some shopping and run some errands, and I'm going to go to Lowe's to pick up something, some screws that I need to fix something, and then I'm going to go because today is Valentine's Day. I'm going to go to See's Candy, and then I'm going to do this, and then I'm going to do that, and we don't talk about going out in the community. We talk about specific places that we're going and accessing the community for specific meaningful activities. So I'm, gonna go to the hardware store. I'm gonna go to the candy store. I'm gonna go. Maybe I'm going to the market to get a nice steak for a romantic dinner for Valentine's Day today, or whatever the activity I'm going to be doing. It's a series of events that are away from the program site. It's away from the home, and I can do it myself. And in there, there's also the control of personal resources so that if I have funds, I can control those funds. Now, this can be sometimes a challenge for providers of residential care more so than day uh, programs because day programs most of the times do not handle anyone's money. But if you're a residential provider, you may be handling personal and incidental funds for that client, and you need to have accounting for how that money is used. Now, there are some individuals who are very frugal with the very, very limited amount of money that they receive every month for personal items, and other individuals could go out and come back and can't show you anything for what they received that day. And so it varies from individual to individual. but people should have control over their resources. And again, the three E's we talk about: exposure, education, and just the opportunities to use their resources how they wish to use them. And if they're not using them in their best interest, maybe providing them with the education about other ways that they can use it, more positive ways that they can use their resources, and doing different things with them. Uh, Recently, I was on one of the CQL presentations, and I brought up a concern about an individual who was engaging in community life and had challenges with diabetes, and came into the facility one day with a large big gulp and and a huge Snickers bar that they had bought with their personal resources, and said, well, how would you deal with that? And the person from CQO was saying that they had a similar experience as a young caseworker, where they went out to an ice cream parlor after having done maybe gone to a movie. A group of about four individuals going out into the community, and they had talked with this one individual prior to going out, saying, hey, wait a minute, you got this issue. You need to get the smallest little cup that you can possibly get of ice cream and do, you know, and follow the diet that your doctors prescribe. Well, as they got up to the counter, the person in front of them got the biggest banana split you've ever seen in your life. And then the client comes up to the counter and says, I would like to have one of those. And the provider, who was quickly thinking, said, well, I got an idea. Why don't we get one of those that all four of us can share, and then we can do it that way? So, it's a matter of, when you're thinking about engaging people in community life, and you have individuals who maybe have unique needs or challenges, to think on your feet. How can we go ahead and have this person uh, as independent as possible, and yet deal with specific concerns that may be out there? So we want to make sure that what's important to and what's important for them are addressed. But at the same time, as a provider, sometimes there are rules and regulations, special diets, concerns about having to account for their personal resources, et cetera, that we have to do. So it's a balancing act, and it's something that you need to do continuously, thinking on your feet on how, wait a minute, how do I assure that this individual has access to the community, but at the same time has it's done in a way that works. Has anybody been assessed yet by a current regional center?
No, I believe that starts in March.
No, they're doing it already. Doing it already.
Yes, we're scheduling already. So we've already scheduled out a few visits for February and March. So you guys should be receiving calls, if you haven't already, for
Yeah,
scheduling those visits.
yeah. No, I'd been talking to Leslie, and that's one of the reasons why they were doing a little bit different. Is I'd like to find out if anybody's had any experience, uh, in addressing this issue. No one has had an assessment yet on the call today.
You know what, Jeff? This is Jamie from KRC. I'm looking through everybody who's here, and the sites that and programs that I've already been to, none of those folks are on here. So
Okay, well,
maybe everybody who's on here, yeah.
well, but this is now, Leslie, is this pretty much what you're going to be looking at for access to the community?
Yes, so we're going to be asking these questions regarding how you guys plan activities out in the community, how you guys get input, if individuals are able to do um, group or individual outings, if you guys support them in those avenues, and how you guys support individuals if they want to stay back instead of doing those group activities. Do they have that option to control their schedule at that time, to be able to maybe not go out if they don't feel like going out at that certain time? But we are looking at these areas. We're looking at control of personal resources, if individuals can manage their own funds, if you do provide them the support, so you guys identify that, and as well as just receiving services out in the community. I know we're talking mainly to the day programs today and the employment, and so it's just ensuring that you support individuals to access that community, to do their medical appointments, to do any of like their daily tasks that they need to be done, that you support them to be able to flex their schedule to be able to do that during their time.
Yeah, and that's an important one that Leslie was just mentioning about flexing schedule. Now, I know some of you are residential providers and are on this call, but you know, but for day and employment people as well, not everybody works 8 to 5, Monday through Friday. And that many times, and especially if you're in the service industry, so if you're working in fast food and um, a big box store, something like that, your hours could be very different. And as especially if you're a residential provider, to have somebody who maybe is coming home at 10 or 11 in the evening from working a shift is something that you need to do. I've in the past had providers tell me, "Oh no, we all go to bed at 8 o'clock," and so we couldn't have somebody coming in that late. And though you've got to provide the opportunities to for clients to work in competitive employment, and if that doesn't uh, if that doesn't work with your current schedule, you need to work on your schedule to make the exception for that individual's employment opportunities. Okay, choice of setting. Um, the setting is selected by the individual from among setting options, including non-disability specific settings and options for a private unit in a residential setting. So, person should have a choice of where they go to programming, and also if they're living in a residential facility, where that residential setting is. Now, in many cases, uh, the individuals that we're going out and will be looking at when we do these assessments have been in our program for many years. And under those circumstances, um, they when they first got there years ago, they may not have been given a choice. It was like, okay, well, we're referring you to NAPD, to social vocational services, to Bakersfield ARC, to CSO. Those decisions might have been made a number of years ago with limited client choice or individual choice. So what we want to do is we want to go back now and at our yearly meeting ask the individual, is this still the setting you want to be in? And again, getting back to the idea of education, uh, an individual, if especially if they've been in your program for many years, may not know that there are other programs, may not know what other programs have to offer. And so people need to be given options about where they receive their services and supports. And that can, in many cases, the individual, in most cases probably, the individual will say, no, I want to continue to be involved in this program. And then you want to document that the client was given options and choices about where they could, the setting that they could be in, and they specifically chose to continue to be in our setting. in the setting that we provide. And these are some of the things that we talked about hey, if you want to do vocational stuff, hey, this other program is all community based. They don't have a site at all. And if maybe you might want to go there instead of coming to the site here and then going out into the community from here. So there are other options available to you as an individual. Setting options are identified and documented in the person-centered plan. So this is what I'm talking about. So you want to make sure your plans say, hey, Johnny was given options and told about other programs and not only just settings, but also different types of services. So maybe somebody would be interested in tailored day services. Maybe they would be interested in the new self-determination program, and where they can work with an intermediary and develop their own type of program setting. So um, these are all options that we want to make sure that we're exploring with individuals and giving them as much information as possible so that the choices that are made are informed choices, are based on the individual's needs and preferences. And again, that can be an interesting thing because what are the person's needs? We oftentimes, especially historically, have looked at you know challenges for an individual, and we base a lot of our decision making on the challenges. This person has uh, some behavioral health concerns. They've been diagnosed with this issue. And so therefore they should go into XYZ program because they work with individuals with dual diagnoses. Well, maybe that's not where the client wants to go. And so going out and looking at what you can do for that individual. Maybe you can develop an individualized plan that can meet that individual's preferences and their needs in a facility by doing something a little different than your historic uh, program setting does, changing schedules, working around what the client's needs are and their hopes and dreams, and doing things very differently. And then finally, and again, today is more on day and vocational, but for residential settings, resources available for room and board. And this is federal stuff, so they use room and board, but we talk about residential services. But if there's somebody that's going into any type of a setting, that can be supported living, could be a group home, could be a small family home, could be a foster family agency, whatever the setting that the person is looking at, they're given choices in terms of where they want to live. People have a right to be treated well. And, this gets back to the old golden rule, treat others as we'd like to be treated. Ensure that individual rights to privacy, to dignity and respect, freedom from coercion and restraint. Privacy can be an interesting one. I mean, two staff people talking in front of other clients about Jones, challenge. No, you talk about that in a private setting. Do clients have a right to have a private discussion with another client, with staff, with other folks? At Bakersfield ARC, where I used to work, clients who had their own cell phone during breaks could go out, to an area by themselves on the setting and make phone calls and talk to whomever they wanted. Dignity and respect. Are people treated like the adults they are, and in a manner that is becoming of their needs. And freedom from coercion and restraint. Well, restraint I've rarely seen. The only restraint I've seen is sometimes people in wheelchairs who need a postural restraint, or else they might flop over. But I have not seen people actually being restrained physically. Now, there is sometimes a concern about the amount of medication that somebody receives. So sometimes people receive medications which are of a psychotropic nature that can create of the effect of, sometimes we've talked about somebody almost being like zombie-like, and so you want to keep away from that. Leslie, anything you'd want to add to any of this?
Thank you, Jeff. So right to be treated well. So definitely these are questions that we're going to be asking during the evaluation, how you support individuals to have access to privacy. Because privacy for certain individuals, we want to ensure that that if you guys discuss anything in regards to like their health or anything of their financial, that you guys provide that with privacy. You guys have those discussions in private, whether it's reviewing their files in private, ensuring that that's locked up to ensure their privacy. If it is in an open setting, that all their documents are locked and stored safely. And the same with just ensuring that they have that access to their files if needed, to have those conversations if they receive a call from their family or a loved one during their programming hours, that are they allowed to have privacy to have that call, whether it's over the phone or a visitor at the site, that you guys afford them that ability to have some privacy to have those discussions. And so it's a big area, definitely, and I appreciate you addressing this,
Okay.
Jeff.
Okay. And anyone out there want to talk about an issue related to privacy or rights that have occurred in their setting? Just open up your mic and speak up.
One of the things that we work at here at Inclusion Films, when one of our students wants to have a meeting with us, we have to remind our other students that they just can't walk into someone's office. They always have to knock first, because we always say, we're giving them the respect. We expect you to have the same amount of respect. So that's just one of those little teachable moments that we do here.
That's an excellent example of how you teach people that to respect others' privacy, but also to model it, so that you're showing clients that, wait a minute, if you come into my office to talk about some concern, you won't be interrupted. You have our attention, and we're going to provide you with the dignity and respect that is important to you, and make it feel like it's a comfortable setting for you to share. So great. I think that's wonderful. Other examples that people have about right to be treated well? The picture that I used here is one of someone at the doctor's office. And unfortunately, there's a lot of research that shows that our individuals, persons of, people with disabilities in general, but specifically with IDD, don't necessarily get the same respect and dignity when they go to see a healthcare provider that the general population does. And that sometimes, due to their understanding of what's being said, and especially since many healthcare providers talk in a medical jargon that is hard for even a typical person to understand. About 50% of people can understand what their doctor is sharing, and 25% maybe have a pretty good understanding. But so that's one of the things too. We want to make sure that if we're involved in someone's healthcare, which is again more residential than day and vocational, but if, for example, you do need to take someone to a medical setting, that the individual is treated respectfully, that the physician or other healthcare provider is addressing the individual and is trying to explain in a manner that they understand what is the visit's about and what treatment is necessary. Okay, the next one that we're going to talk about is independence. Optimized but not regiment individuals. Um, this means that we want to try to not do it based on just on a schedule. Uh, I went out to one provider that was the excellent provider, one that I really have always had a lot of respect for. And one of the DSPs said, well, we have George in our program, and from 2 to 3 in the afternoon, when we're doing the cooking class, George will either disappear, he will sit in the back of the room and he won't participate. He will, you know, purposely mess up things, and be oppositional. It's just not a good experience. And how do we get George to be more cooperative with our 2 to 3 o'clock in the afternoon cooking class? And my response to the individual was, well, maybe George is not interested in the cooking class. And what other activity of George's choosing can he participate in or partake in from 2 to 3? So when we talk about optimize but does not regiment individuals, that's what we want to do. We don't want to, it's not about, okay, um, if you come into our program from 8 to 9, we do this. 9 to 10, we do this. 11 to 12, we do this. 11:30 to 12:30, you have lunch. And 1 to 2, that doesn't take into consideration what the individual wants. There's the old joke from years ago of the tail wagging the dog. And that's kind of what that is. The system that we work with talks about individual choices and the client's needs, not the program's needs. So it's not about, well, we have this set up so that it works for us to have this program from this time to this time. We don't want that. We want there to be optimization based off of what the individual wants, and we want to show initiative. We want to do things differently. We want to ask people what they want. Autonomy and independence in making life choices. We want to let people make choices for themselves, including but not limited to daily activities, physical environment, and with whom they interact. So, anybody have any examples of independence that they've worked with in terms of individuals in your program?
I'd like to add what I've observed at a setting.
Okay.
So I know, like, typically, like, programs, they arrange a curriculum of how the day could go. And somehow, some programs, they have that calendar of events, like, we've planned out this for the week. Everybody's agreed on a census of what they would like to do, and they've provided that input for building that schedule. And then I noted that they had little sheets on the side where they pivoted, and they mentioned on this day, uh, the individual or the class had requested to do a different activity. And so they documented that and showed where they would be changing the activity of the day. And so, like, it's wonderful because it shows that it allows that individual to have that ability to change their schedule. Even though you guys have a daily planned activity, you guys have the ability to have that change. And just seeing kind of that form there, it shows and supports that you identify that individuals can make that change and be flexible in
Oh,
that schedule.
so if the group says, hey, we've been to the community center for the last 5 weeks, and that's kind of boring. And I know it's on the list for to do today, but we'd really rather do something else. And the group then decides, well, let's go to a movie. You want to, on your scheduling, put down that the group, changed what they wanted to do. They were scheduled to be at the community center. Maybe they were going to have a lecture or something there that day, and the group said, "Nah, uh-uh, we want to do something else." So what Leslie is sharing with you is document. And you know what? I didn't mention this earlier, but that's the name of the game, unfortunately, these days in many aspects. Is documentation. So that when the team comes out, they're going to be looking at a couple of different things. They're going to be talking to you, probably talking to your DSPs and to individuals who you're serving. So that's one part. But they're going to also ask to see certain records, and you're going to need to be able to provide that. And if your records don't reflect that the client has been part of the process of what goes on. So if it's just okay, well, we have the IPP that was sent by the regional center. We have a copy of the purchase of service agreement here in the file. We have an admissions agreement. We have this and we have that, and then there's nothing to really reflect that what you've done for that individual and how they've given input into the process, then you've really sort of failed because you're not really doing person centered. You're doing, it's paper, not people. And we really want to focus on the people that we're serving and making sure that the services and supports that they're receiving uh, are consistent with what they want and what they need. So, and included, but not limited to daily activities, physical environment, and with whom they interact. So, also, that's an important thing. Who do people interact with during the day? Do they have choices about who they want to be with? I mean, I have friends that I want to be with. There are people that I probably prefer not to be with. And do I have the choice to make that decision? Or do I get to sort of lumped into this is the 2 o'clock class and you're in the 2 o'clock class? So, go on down and, maybe there's somebody I don't really like to be with. Maybe it's not, I'm not interested in learning cooking skills. There could be a lot of things. So I should be given the choice to in my daily activities. Um, okay. The next one is facilitates individual choice regarding services and supports and whom provides them. Now, this again can be a little tricky. I mean, if you're a day or a vocational service provider and you're having some significant staffing challenges, because everybody seems to be having significant staffing challenges these days. Combination of post-COVID and just the labor market is very different today than it was 4 years ago. And then also the wages that we can pay. Come what is it? I think March or April of this year. Fast food restaurants that have over a certain number of restaurants are going to have to start paying $20 an hour for people. So it really puts a damper on the ability to recruit staff. So when we say who supports them, maybe I say, hey, I really like working with William. Well, William gets another job. So that can be sometimes a challenge, but to the extent possible, uh, individuals should be allowed to have a choice about who provides them with the service among from the people that you have available to provide the services, and a choice about those services and supports. Which ones do they like? Which ones would they prefer not to do? So if you're in a program setting, you're a provider of day services, or let's say you're doing supported employment or competitive integrated employment type services, the client should have a right to what they want to do. It's not, for example, for employment. Uh, oh, we got a new contact with ABC Lighting, and they want a client to work in their warehouse. So, John, we're putting you in their warehouse. Well, maybe that's not what John wants to do. Maybe he'd rather work outdoors, and with gardening or some other construction or something to that effect. So we really didn't give the client a choice. We just, okay, here, we developed a job. You're on the list of people who need a job. Hey, here's your job. And we really didn't take into consideration what the person was interested in. Comments, Leslie?
Thank you, Jeff. So for choice and services, I definitely would just like to add is just identifying if individuals can have the ability to work with staff that they feel comfortable with. So if they receive personal care services during the time they are with you, ensuring that they feel comfortable with that staff that's providing that care, just like anybody else. To give you like a little story, is like if you were to think of your own self, would you feel comfortable with just any stranger assisting you, or would you feel comfortable identifying and choosing who you feel comfortable with to provide you that care? Uh, and so identifying that and ensuring that you support individuals if they have um, language barriers, that you assist them with finding the most appropriate fit for the staff that can help us support them with that alternative method of communication, whether that is um, a different language or maybe nonverbal communication, maybe staff that know how to understand the individual method that they communicate with, and ensuring that you provide them those options. Thank you.
Uh, a good
Jeff,
example of that was,
I kind of
go ahead.
had maybe a question or however it would like to be addressed. But from my understanding, in certain services, there is a ratio to staff, correct? Like you have to have, I don't know, a group of
Uh-huh.
2 or 3 or so. So what
Right.
happens when you're required to have that group, but and everyone decides that they're going to go and do their own thing? And everybody's in unison that they all want to go to this particular place. But like we had mentioned, say that one individual wants to stay back, and it's just that one individual with the staff. Um, because of knowing that it has to be a certain ratio, is there still funding that's available for that staff? Because now it's a one-on-one if it had to be in a group setting.
No, unless there is as part of the planning process, something gets placed into that person's individual plan, and the regional center approves it. Traditionally, the funding is based off of how that program is vendored. So if you're vendored as a 1 to 3, 1 to 4, 1 to 6, that's how your groupings are. But in doing that, um, I've seen some flexibility that some programs have utilized, and historically it's been accepted. So unless Leslie or Jamie tell me otherwise, where you can potentially take, I'll say, let's use an example of 1 to 4 for a staffing ratio. You take a group of 5 or 6, and then another group is 3 or 4. So if you add the staffing ratios together, 2 groups would be 2 staff for 8 people, but one group is going out with 5 people and another group is going out with 3 people. So you're meeting the 1-to-4 ratio, but you're having some flexibility within that. And so that's how I've seen that done in the past to a certain extent. But yeah, when you get into one client who is by themselves and isn't wanting to cooperate, and that becomes a issue, fairly regularly, I think it's time to reconvene the individual planning process because it's all about person centered. And maybe that person needs to look at some other options and find an option that better suits what their needs are, because clearly what they're telling us in some ways is they don't want to do some of the service model that their current provider is offering. And the ability to individualize it is somewhat limited by staffing ratio. So that's an excellent question. And Leslie or Jamie, you guys want to address this at all?
Yeah, of course. So I would just like to chime in and add what you were going on, Jeff. So like if it is something that you guys notice consistently as a pattern for a certain individual, that they're wanting to just decline participating in certain activities, identifying, having that discussion, because all this comes to conversations with the individual, identifying what they would like to see, what might possibly be their concern, whether it's the group that they're currently in, or maybe they're not getting along with somebody specifically, or maybe they identify maybe the tasks or activities that are planned out aren't meeting their needs. And so addressing with them, seeing if you could help individual advocate what they would like to see different and what you guys could support them with, and identifying that, whether it's bringing it to the table, reconvening with that group on a certain activity and saying, hey, like our individual's vegetarian and we keep going to places that are primarily like meat eating. And so like we want to ensure that the individual's heard and how we could best support them in that avenue. And if you guys identify after conversating with the individual that maybe this uh, group isn't the best fit, what are the alternatives you guys could do? Maybe it's just that case by case basis where maybe they're just not feeling well for that day or that week. Like, is there something that you guys could support? Some programs, they have that flexibility of having some staffing at the program site that could stay behind to help support. So it might throw the ratio off for that outing, or it could be blended with the current staffing that you have available. And it could be just having that discussion with individuals if you guys do have that limited staffing, how you guys could overcome this, how you guys could hear the individual out with their concern versus pressing them to do activities that they don't like. Most of the time, some individuals might need to be heard and understood, and how we could support them to meet that, even if at the time you guys might not be able to change the whole activity because everybody's planned the activity set for the day, but hearing input and sharing with them the time that you guys can discuss and reconvene to make those adjustments with that activity planning so that they're heard. But it's a very
Thank
good
you.
question. You
Yeah,
guys
yeah,
identified
thank
that there is plenty more. You guys could always readdress it with the team, their planning team, to discuss maybe with the individual if it is requiring that level of care for like one-on-one, that you guys could discuss that. But those are on those cases where the individual does require that assistance for that one-to-one. But yeah, like as financial options, we got to work with the model that we have currently.
Yeah. Anybody have an example of something that they've done with staff flexibility to meet the needs of one or two clients, or when a group is doing something else?
So here at Inclusion Films, one of the things that we do usually monthly is we go to the movies, because Maya Cinema is right up the street from us, and we milk films. So obviously that's something that our students like to do. But there's always the option, if you don't want to see the movie, that you can always stay back here with staff that aren't going to the movies and just, do another project or do something that will engage you. So we do accommodate for that.
Okay, and again, if you can document that too, that way, but on this day, this individual, in case notes, that so that shows that you're really focusing on the individual in terms of what their needs are. And then I've got one last slide. This is for all facilities, being either day, residential, any setting. The setting is physically accessible to individuals. So we want to make sure that what we're doing within the settings that we uh, utilize for our own setting, and also if we're taking groups out into the community, we want to make sure that the places that we're going to can accommodate all of the individuals that we take in that group. Any questions on this one? That's pretty
Oh,
straightforward.
that is a good one.
Yeah.
Yes, I do want to just acknowledge that for day programs, this can be a tough area to think about if you do have individuals that need those accessibility needs. Is just kind of pre-planning and identifying settings that can meet that individual's needs. If they do require personal care assistance for bathrooms, identifying which bathrooms support the individuals might be something you might want to keep in mind as you help support planning those activities to let the individual know.
Yeah, and again, that can sometimes be a challenge if you're like a 1 to 6 group and an individual needs assistance with using the restroom, and you only have the one staff person, and how do you accommodate that? And this is again, as a DSP or as an administrator, you need to think on your feet in terms of how you could accommodate all the individuals in your group. Also, what happens if you do have somebody who is needs assistance in the restroom, in a public restroom, and the staff person is of the opposite sex of the person who needs the assistance? And those are all issues that can at times be needing to be addressed. Okay, it is 11 o'clock or 11:01 actually. And any questions or concerns about anything that was addressed today that you'd like to ask either me or the two regional center folks that are on this call as well? Okay, with that, we will say goodbye to everyone. And again, encourage you if you are available tomorrow for the person-centered planning, you can still sign up for that. There's 20 some folks we can take up to a maximum of 40. So, and Sean, thank you for the happy Valentine's Day, and happy Valentine's Day to all of you. Hope you have someone in your lives that you can share this day with, and wish you the best. Take care. Bye bye.
Thank you, Jeff.